So I need to say something right off the bat before I start the whole conversation in the video. My daughter took a look at the video and she thought it wasn't clear enough that if you have an ultrasound and they see a fibroid, do not worry, okay? They're benign. They might cause symptoms and we can take care of the symptoms, but they're nothing that's gonna bother you further than that. Hi, I'm Dr. Wendy Wagner, and I'm doing the second part of my discussion about fibroids, this one about treatment in OBGYN topics. So, to recap very quickly from last time, fibroids are a benign growth of the muscular portion of the uterus. Okay? There's three different types. Intramural, which is the body of the uterus, subserosal, which is in the outside of the uterus, and submucosal, which it has some involvement with the cavity of the uterus. The only reason that these would need to be treated is for symptoms, most common symptoms being abnormal bleeding or bulk symptoms or pressure symptoms which affect the pelvis. So when we talk about treatment, there are really three options for almost any kind of treatment in medicine. There's expectant management, where we do nothing and we just keep an eye on what's going on. There is medical treatment, which includes generally medication, in this case mostly hormonal medication, and there is surgical treatment. So we'll start with just a short discussion about expectant management. Some people do, even though they have some abnormal bleeding or they have some pressure symptoms, choose to just keep an eye on the fibroids. Fibroids are normally fairly slowly growing, so we could keep an eye on them with just checking symptoms. We can do ultrasounds on a regular or irregular basis, or just with annual exams, see if there's some issue with the growth of the palpable size of the uterus. So that's one option. Most people, when they do have symptoms that are bad enough, choose some kind of an intervention, whether it be medical or surgical. Some of the medical intervention depends on exactly what symptoms are present. So there's much different intervention whether there's abnormal uterine bleeding than whether there's bulk symptoms of the uterus. So with abnormal uterine bleeding, we can do things to control the bleeding, which doesn't necessarily do anything about the size of, or the presence of the fibroids. So if somebody has fibroids that are causing them abnormal bleeding, we can offer some different interventions like low-dose birth control pills, which do not seem to cause increased growth over the normal growth of fibroids. We can talk about doing an IUD that has some progesterone hormone in it, which should decrease the amount of bleeding monthly. Some people will also opt to have progesterone-only contraceptives, whether it be Depo-Provera or oral progesterone if they can't take estrogen, which can decrease the amount of bleeding. The other side of the coin is something called Lupron. Now, because estrogen feeds the growth, which is why these are only an issue during cycling years, not an issue in prepubertal or postmenopausal women, the estrogen is what feeds it. So there is something called Lupron, which cuts off the estrogen, okay, and it can cause decrease in the size of the fibroid. Now, a couple issues with this and why it's not used on a regular basis for fibroids is that because it cuts off the estrogen, it's going to put people, it's going to give people menopausal symptoms. So hot flashes, things like that are going to be present because of lack of estrogen. The other issue is over time, if you use this for long periods of time, there could be issue with bone loss and other things that occur with prolonged lack of estrogen. So many times what Lupron is used in order to shrink the fibroid before another type of intervention like hysterectomy or myomectomy is done. As far as surgical treatment also depends on the type of symptoms the patient's having, whether it's abnormal bleeding or bulk symptoms, and a lot of it also depends on whether a woman is interested in future fertility or not. So, very straightforward as far as possibilities of treatment surgically. We can, if there is a submucosal fibroid, we can go in with a hysteroscope, which is a thin instrument that goes in through the cervix, and we can remove the fibroid this way, transcervically. This is a same-day surgery and usually works very well. This usually is an option with people who don't have bulk symptoms but have abnormal uterine bleeding. Very often when we get rid of the fibroid, that will help with the bleeding. The other surgical intervention that helps for abnormal uterine bleeding is something called an endometrial ablation. So if a patient has abnormal bleeding, we can basically get rid of the lining of the uterus with, again, a same-day surgery called endometrial ablation. I will again cover that in another video later on. But regardless of where the fibroids are, this will help with the bleeding, but won't necessarily get rid of the fibroids. The hysteroscopy and what we call myomectomy, which is removal of the fibroid, which I talked about first, will get rid of the fibroid, but only the submucosal fibroids. So if we have fibroids that are in the body of the uterus or in the outside of the uterus, there are two options for that. Well, there's actually three options, but we'll talk about two surgical options right now that are done by a gynecologist. One is a myomectomy. So different than the myomectomy through the cavity of the uterus, this is done surgically. It can be done either laparoscopically through small incisions made in the abdomen, or it can be done with an open incision. This is a decision made depending on the size of the fibroids, other history, things like that. But basically what happens is the fibroid is removed. So whether it's out here, whether it's here, basically the fibroid is removed. The remainder of the wall of the uterus is repaired and closed, and that should actually get repaired very well. Two issues with this. One is that if the fibroid is removed and there is some entry into the cavity of the uterus on removal, so in other words, if you have a fibroid that goes through the whole body of the uterus and you have to carve that out and repair the edges, but you enter the cavity, it's not safe to have vaginal delivery. It's not safe to go through labor after that. So in a case like that, the patient would have to have a C-section afterwards for safety reasons so that there's not rupture of the uterus. So normally a myomectomy is reserved for women who have bleeding or bulk symptoms and want to preserve future childbearing. Now, in the absence of wanting to preserve future childbearing, the next option is a hysterectomy. So it's actually to get rid of the whole organ that has the fibroids. And as you can imagine, it's somewhat of an easier surgery because whether or not you take the cervix, you can either take the cervix or not, and you basically get rid of everything. And that does not require going in and repairing the uterus. Hysterectomy can also be done laparoscopically, can be done vaginally, or it can be done with an open incision, and that has its own risks and benefits and decision making. The final option for treating fibroids in a surgical manner, and again, this is for people who don't desire future childbearing, is called uterine artery embolization. So short for uterine artery embolization is UAE. Fibroids are very vascular, so there's a lot of vessels feeding the fibroids, and the bigger the fibroids are, the bigger the vessels that are feeding the fibroids. So if you have large fibroid here, and there's that, the vessels come in here and they go up and they go throughout the fibroid, an interventional radiologist can actually thread a catheter through the fibroid, and by putting something in through the catheter, they can block off the blood supply to this fibroid. The fibroid then, over the next 6 months or so, will get smaller because of the lack of blood flow. Now, there can be some pain involved in this, but it is an option that can be done if there is an interest in doing a myomectomy or a hysterectomy or any more invasive treatment. Again, There are no studies in pregnancy and childbearing following this, so it is reserved for people who aren't interested in future childbearing. So to just quickly sum up, fibroids, 3 different types. They can be treated medically. That treatment is through mostly medication that slows the bleeding that we would really use for any other issue that causes abnormal uterine bleeding. The other options are surgical. Those options include myomectomy, taking out just the fibroid, hysterectomy, removing the uterus, or uterine artery embolization. The myomectomy, again, can be done in a same-day surgery through the cavity of the uterus, or if there's not an intracavitary fibroid, it needs to be a more invasive surgery. The hysterectomy and myomectomy can be done laparoscopically or with an open procedure. And that's it.